patient's mental status and speech, the cranial nerves, the motor system, the reflexes, and the sensory system. Keep in mind that the nervous system exam will vary widely depending on your patient's condition. This program will present the information needed to perform a baseline exam. If your patient has a specific neurologic problem or emergency or is comatose, she'll need additional testing.
Comatose, really?
For your examination, have you changed into a gown, please?
To prepare the patient, ask her to undress, put on a gown, and sit on the examination table. Make sure that the room is quiet, well lit, and warm, and that you've gathered the necessary equipment. In most cases, you'll assess your patient's cerebral functioning by noting her mental status and speech throughout the exam. During this time, observe and assess her level of consciousness, general appearance and behavior, and speech. Also, assess her ability to pay attention, remember, and understand. If you suspect an abnormality, follow through with more specific questioning and/or testing. Because the abnormal functioning of specific cranial nerves helps to identify the location of nervous system lesions, assess the cranial nerves. There are 12 pairs. The first cranial or olfactory nerve is responsible for the patient's sense of smell.
Good.
After making sure her nostrils are patent, occlude one nostril. Then, under the other, hold a substance with a familiar and non-irritating odor, such as coffee.
And tell me what you smell.
Repeat the test using another substance. Then, repeat the test on the other side. Normally, the patient should be able to smell and identify the odors on each side. A unilateral loss of smell without nasal disease suggests a frontal lobe lesion. A bilateral loss of smell suggests many conditions, for example, nasal disease, excessive smoking, cocaine use, or a congenital problem. The second cranial or optic nerve is responsible for the patient's vision. Assess it by testing visual acuity and visual fields. To test visual acuity, have the patient stand 20 feet away from a Snellen eye chart. Then, ask her to cover one eye with a card, and with the other, read the smallest line of print that she can. If the patient reads more than half the letters from that line, record the numbers listed at the side of the line as her visual acuity. Then, have her repeat the test with her other eye.
D-O-T-E-C.
Now, test the patient's peripheral visual fields by confrontation. Face her and keep your eyes on the same level as hers. Have the patient cover one eye and look directly at your eye, which is opposite her. Close your other eye. As you look at each other, her visual fields will roughly mirror yours. Now, slowly bring a pencil or other object into your peripheral field of vision. Ask the patient to say "now" as soon as she sees it. Perform this test bringing the pencil from 8 different directions. Then repeat it with the other eye.
And cover your left eye now.
Visual defects you may note during this test include a horizontal defect, a blind eye, bitemporal hemianopsia, and left or right homonymous hemianopsia. Next, assess the 3rd, 4th, and 6th cranial nerves. The 3rd cranial or oculomotor nerve is responsible for pupillary constriction, eye opening, and most extraocular movements. The 4th cranial or trochlear nerve for downward and inward eye movement, and the 6th cranial or abducens nerve for lateral eye movement. To assess these cranial nerves, First, inspect the size and shape of the patient's pupils. Compare one side to the other, keeping in mind that a slight inequality may be normal. Usually, the pupil is midpoint. Dilated or constricted pupils may result from such factors as medications, drug abuse, glaucoma, and neurologic disease. Darken the room to test pupillary reactions to light. Ask the patient to look straight ahead. Then shine a bright light obliquely into one of her pupils. Watch for the direct reaction, pupillary constriction in the same eye, and the consensual reaction, pupillary constriction in the opposite eye. Repeat this test on the other side.
Okay, Ms.
Now,
I'm gonna
assess
test
for
your
the near
near
response
Just
by
follow
asking
my
the
finger.
patient to follow your finger as you move it in toward the bridge of her nose.
That's fine.
Watch for her pupils to constrict, her eyes to converge, and the lenses of her eyes to become more convex or accommodate. Next, test the patient's extraocular movements. You'll be looking for the normal, conjugate, or parallel movements of the patient's eyes in each direction, any deviation from normal, and any nystagmus.
I'm gonna watch
Ask
your
her to follow your finger with her eyes as you move it through the 6 cardinal fields of gaze. Making a wide H in the air with your finger, lead the patient's gaze to her right and up, and to her right and down. Then, without pausing in the middle, to her left and up, and to her left and down. Normally, the patient will be able to follow your finger with no strabismus or nystagmus. Finally, look at the patient's upper eyelids for ptosis, or for the lid drooping over her pupil. Normally, there will be none. But you may note it if the patient has third cranial nerve palsy or a disease such as myasthenia gravis. Now, assess the 5th cranial or trigeminal nerve. Its motor function is responsible for temporal and masseter muscle movement and lateral movement of the jaw. Its sensory function is responsible for facial sensations. Assess the motor function by palpating the patient's temporal muscle. While doing so, ask her to clench her teeth.
Clench your teeth.
Note the strength of the muscle contraction. Now, palpate her masseter muscles as she clenches her teeth. Note the strength of the muscle contraction. Unilateral weakness, or absence of contraction of either or both of these muscles, suggests a 5th cranial nerve lesion, whereas bilateral weakness may suggest upper or lower motor neuron involvement. Assess the sensory function of the 5th cranial nerve by first asking the patient to close her eyes, then, using an open safety pin or other sharp object, touch her forehead on each side to test for pain. Ask her whether the sensation is sharp or dull, and to compare sides. Occasionally substitute the blunt end of the pin for the point. Repeat this procedure, touching the patient's cheeks and jaw on each side. If there is a unilateral decrease in or loss of facial sensation, suspect a 5th cranial nerve lesion. Confirm any abnormality by testing temperature sensation. Next, test for light touch by asking the patient to respond whenever you touch her face with a fine wisp of cotton. Finally, test the patient's corneal reflex. To do so, ask her to look up and away from you, approaching from the other side and out of her sight. Touch her cornea lightly with a fine wisp of clean cotton. She should blink. If she doesn't, suspect a 5th cranial nerve lesion or possibly 7th cranial nerve impairment. Or she may be wearing contact lenses, which will diminish the response. Repeat this test on the other eye. Next, assess the seventh cranial or facial nerve. Its motor function is responsible for facial movements. Its sensory function is responsible for taste on the anterior 2/3 of the tongue. However, normally you won't need to assess taste during a routine exam. To assess the motor function, observe the patient's face both at rest and during conversation. Note any asymmetry, signs of facial weakness, such as drooping of the lower eyelid, or abnormal movements, such as tics. Then observe her face for these abnormalities, while you ask her to do the following. Raise both of her eyebrows. Frown. Then tightly close both eyes. While the patient's eyes are closed, test muscular strength by trying to open her closed eyes. Continue assessing seventh cranial nerve functioning by asking the patient to show both her upper and lower teeth.
It doesn't look that yellow on here.
Smile. And then puff out both cheeks. If the patient has weakness or asymmetry of both the upper and lower face, suspect a lower motor neuron lesion such as Bell's palsy. If you observe the weakness or asymmetry primarily in the lower face, suspect an upper motor neuron lesion. Now, assess the eighth cranial or acoustic nerve. Its cochlear division is responsible for hearing, while its vestibular division is responsible for balance. Usually, you'll test only cochlear function. To estimate the patient's hearing, test one ear at a time. Ask her to occlude one ear with a finger. Then whisper softly toward the unoccluded ear. Ask the patient to tell you what she hears.